Honorable chairpersons and all esteemed colleagues, over next 13 to 15 minutes, I am going to take you through this allotted topic. My presentation will explore how advanced AI can transform metabolic medicine. Diabetes, obesity, and metabolic liver diseases are surging worldwide, and they are straining the healthcare structure all over the world. And our current care model, unfortunately, is often reactive, treating complications rather than preventing them. So AI combines genomics, lifestyle, clinical, and environmental data to identify high-risk people. This allows doctors to provide personalized lifestyle adjustments and treatments before the disease actually develops. AI provides ongoing insights, forecasts the course of diseases, customizes care, and offers prompt advice to close gaps in access to specialists when paired with wearable technology and real-time monitoring. I would make this statement: artificial intelligence, the future is now. It's already here. And why? Because of explosion of big data like EHRs, variables, genomics, and we have advances in generative AI, which includes context-aware text, image, and multimodal learning, and a very fantastic combination of cloud computing and federated learning enables secure, scalable adoption in our day-to-day practice. So what is cloud computing? Cloud computing refers to utilizing services such as storage, software, and servers over the internet, which is the cloud, instead of depending on our own computer or local servers. In metabolic medicine, it enables clinicians and researchers to access large patient data sets, run AI models, and share results on demand securely and at scale without the need for their own extensive IT infrastructure. Use of Amazon Web Services or Google Cloud to run a deep learning model that analyzes millions of liver ultrasound images instead of relying on local hospital servers is a good example of cloud computing. Federated learning is a machine learning approach where AI models are trained across multiple institutions or devices without centralizing the data. In healthcare, this is critical because patient data is sensitive and often cannot leave the hospital firewalls due to privacy laws. And these are two laws which are prevalent in USA and the UK respectively. Federated learning allows collaboration without breaching privacy. And a global model predicting diabetes complications, for example, could be trained using data from India, the USA, and the Europe without transferring raw patient files between the countries. Generative AI enhances efficiency and personalization for both clinicians and patients. How does it do that? It summarizes guidelines. For example, it converts complex ADA ESD standards into patient-friendly contextual advice, and it can draft clinical notes, discharge summaries, and referrals, thus reducing the clinician overload. And AI can generate culturally relevant diet charts, infographics, or counseling scripts, so that enables patient education. Predictive analytics, at the bottom I have inserted that. Predictive analytics shift the focus to anticipating diseases rather than waiting for complications. So for type 2 diabetes, predictive analytics can identify high-risk pre-diabetes patients before they develop into full-blown diabetes. Non-invasive tools are in place which forecast which patients will progress from muscle to MASH or cirrhosis. Then AI and predictive analytics can predict the risk of myocardial infarction or stroke in patients with metabolic syndrome. And AI can also flag patients likely to miss doses, enabling proactive intervention. AI can identify people who are non-adherent and thus can help us motivate the patients to remain more adherent to our advices. Then multi-layered data integration is the key to AI's power. So how is AI doing all this wonderful job? It can integrate large volumes of clinical data, traditional EHRs, labs, drug prescriptions, genomics, metabolomics, and microbiome data. And it can integrate inputs from continuous glucose monitors, smartwatches, step trackers, and AI at the same time can analyze liver elastography, retinal photos, and MRIs. So diabetes remains the most advanced proof of concept field for AI in medicine. AI is already FDA approved for screening for retinopathy. Algorithms are in place to forecast low sugar events, especially in insulin treated patients. Virtual assistants provide automated reminders and motivational nudges and thus improve adherence. And a great combination of CGM plus artificial intelligence can provide real-time lifestyle advice, linking meals, sleep, and stress with glucose excursions. Nutrition and obesity is another area which can benefit uniquely from AI's personalization capacity. So AI analyzes food logs and metabolic profiles to tailor diets. AI can generate advice in local languages and culinary traditions. And AI can also predict for us who is at risk after, for example, bariatric surgery for closer monitoring of that individual. And AI assisted food logging automation can recognize images and allow accurate, effortless food tracking. And AI at the same time helps address a lot of has been said in the previous talks about muscle and liver issues. So AI can help us address the silent liver epidemic of MSLD and MASH early and accurately. AI improves non-invasive staging of fibrosis versus a biopsy, and this is proved. And it can integrate genomics, labs, and lifestyle data, and these are all combined for precision and stratification of liver diseases. Trajectory prediction, that means AI can assist us in identifying muscle patients who are likely to progress to cirrhotic stage or unfortunately to HCC. And then AI helps us decide who needs medication versus lifestyle first approach. Whether do we go for the both the approaches at a go, or we can try lifestyle. So that is also informed by AI. AI in hypertension spans from prediction to precision care. The machine learning models integrate BP variability, genetics, lifestyle, and EHRs to identify patients at risk before. So in pre-hypertension stage, they are picked up. Wearables and Internet of Things devices like smart BP cuffs, watches, feed AI dashboards for real-time BP trend detection and anomaly alerts. Means any deviation will be picked up. AI clusters hypertensive patients into phenotypes. This is again very useful. For example, it can classify patients into salt-sensitive, nocturnal non-dippers, which helps tailor treatment pathways. Predictive analytics suggests best antihypertensive class per patient based on genotype-phenotype linkage and treatment response. So that's another area of research and benefit that is already being realized from AI. And AI-driven screening tools support national hypertension programs and identify underserved high-risk groups. So the epidemiologically also it comes of age and of great benefit. Then we can harness AI for cerebrocardiovascular prevention and management. So their deep learning can integrate imaging, labs, ECG genomics, and lifestyle to predict stroke, MI risk more accurately than conventional risk scores. We have been that certain risk scores were referred to by the previous speaker, but when AI comes into play, the picture becomes more reliable. AI interprets CT angiography, MRI brain, and carotid ultrasound to quantify atherosclerotic burden and detect subclinical disease. Wearable AI ECG patches detect atrial fibrillation, which facilitates timely anticoagulation and stroke prevention. Predictive models monitor adherence, optimize therapy, and prevent recurrent events. AI can highlight ethnic disparities, for example, higher stroke burden in South Asians, and thus support equitable precision prevention programs. AI also accelerates research in cycles. Research cycles are also facilitated. We can have literature summaries and instantly have a manual, have an instant review of a manuscript, for example. And hypothesis generation is also helped by AI. AI can spot novel patterns across data sets. It assists in clinical trial frameworks and inclusion-exclusion design. AI helps in optimizing recruitment, and so it acts like a trial co-pilot. It helps in optimizing recruitment and adaptive trial monitoring. So, but we need to be we need to be aware of certain ethical issues. So we have to avoid bias, ensure AI works across ethnicities and age groups, ensure privacy, where federated learning really is of great help. Transparency. Models must be interpretable by us, all clinicians, and it should be, worthy of our trust. And we need not over rely on AI, as it is only a support tool, not a substitute for clinical judgment. And there are certain barriers like fragmented IT, many EHRs lack interoperability, and training gaps. We clinicians need to be AI literate. Cost is again a dampening factor in certain situations, and regulatory hurdles are there, but adoption barriers do exist, but we can address those through effective policy and planning. Now, a few before I end, honorable chairpersons, I'll quote few success stories. FDA-approved tool is widely used for picking up diabetic retinopathy. Mayo Clinic Google MASLD AI tool, which has been in use since 2023, detects fibrosis accurately. AI reduces readmissions, and real-time decision support for insulin titration is available in our endocrine clinics, courtesy AI. AI can, convert complex concepts into it can simplify these concepts into animations. Chatbots are 24/7 available for answering patient queries. And gamification is another new upcoming thing where AI-driven incentive improves lifestyle adherence. And I have quoted two examples. They are available online. So generative AI boosts adherence by increasing engagement and motivation. And in future, digital twins will probably facilitate personalized disease simulation and intervention testing. Multimodal AI simultaneously can process labs, imaging, text, and lifestyle inputs. Federated learning allows global collaboration without data sharing. And real-time precision facilitates instant bedside decision support. So in conclusion, AI and analytics are transformational tools that move our care from reactive to proactive, and AI can help us focus on precision prevention and personalization. And combination of human and AI synergy is definitely going to ensure greater success in our day-to-day practice. Thank you very much. These were few references besides ones that I quoted in my slides. And thank you all for your patient hearing.